During this time of COVID-19, as cases are continuing to surge and show no signs of slowing down, it is important to emphasize to all to wear masks. In this video, we will explain what purpose face masks serve to help slow the spread of COVID-19 and any airborne disease for that matter. Although there are various types of face masks, including the commonly used surgical mask and N95 mask, we will focus on face masks overall and avoid paying attention to certain types. Today, we will elaborate on case studies and show the results to prove masks are in fact efficient in reducing transmission rates. As you may know, there are two types of people. There is no doubt masks can be uncomfortable with one side complaining all the time, but they serve a much greater purpose, which the other side realizes and wants to help slow the spread together. We like to ask, how efficient are these masks? These masks are designed to protect the wearer's nose and mouth from contact with droplets, splashes, and sprays that may contain germs. A mask also filters out large particles in the air. This may protect others by reducing exposure to the saliva and respiratory secretions of the mask wearer. If two people are wearing masks, the viral particles can travel about 5 feet away from each individual. When an infected person is not wearing a mask, those particles can float through the air and can stay alive for up to 30 hours. Trapping droplets with the mask means not nearly as many viral particles escape. So when all parties in a gathering are wearing well-constructed, well-fitting masks, it provides an extra layer of safety for everyone. Masks may be more effective as a source control because they can prevent larger expelled droplets from evaporating into smaller droplets that can travel further. In virtually the majority of states, mask mandates have been set to implement the use of face masks. A recent study compared the COVID-19 growth rate before and after mask mandates in 15 states and the District of Columbia. It found that mask mandates led to a slowdown in daily COVID-19 growth rate, which became more apparent over time. The first 5 days after a mandate, the daily growth rate slowed by 0.9 percentage points compared to the 5 days prior to the mandate. And by 3 weeks, the daily growth rate has slowed by 2 percentage points. The CDC has recommended people over 2 years old to wear masks in public to reduce the spread of COVID-19. The mask will reduce fecal and oral transmission by preventing the virus from getting into your nose or mouth if you touch a contaminated surface and then your face. 230 to 450,000 infected cases can be averted due to these mandates. In experiments conducted for laboratory studies, an experiment using high-speed video found that hundreds of droplets ranging from 20 to 500 micrometers were generated when talking, but that nearly all these droplets were blocked when the mouth was covered by a damp washcloth. In a research study using hamsters in 2 cages, one group of hamsters infected with COVID-19 and the other healthy. The researchers created 3 different scenarios. Mask barriers placed just on cages with infected subjects, masks covering the healthy subjects, and one with no mask barriers at all, with a fan between the cages allowing particles to be transmitted between them. Hamsters were chosen in the experiment for their very similar enzyme receptors to humans. With no mask barriers at all, 2/3 of the healthy hamsters were infected with the virus within a week. When the mask was placed over the infected cage, however, the infection rate dropped to 16.7%. The infection rate went up to 33% when the mask barrier was only used to cover the healthy hamster's cage. The hamsters who were still infected despite having the mask barrier also had less of the virus in their bodies compared to those infected without the masks. It shows very clear that if affected humans or hamsters, especially asymptomatic or symptomatic ones, put on masks, they actually protect other people. Once again, this experiment cannot be disregarded as hamsters have very similar enzyme receptors to humans, which is why they were chosen as the test animals for this specific experiment. Next, a compelling case report also suggests that masks can prevent transmission in high-risk scenarios. In one case, a man flew from China to Toronto and subsequently tested positive for COVID-19. He had a dry cough and wore a mask on the flight, and all 25 people closest to him on the flight tested negative for COVID-19. This serves as a prime example that wearing masks can benefit those wearing it and to those around you. It is important to note that even if you live in a community where few people wear it, you would still reduce your own chances of catching the virus by wearing one. In conclusion, wearing a mask is your best bet to avoid catching the virus for yourself. Putting a face mask on does not mean that you stop the other practices. In addition to wearing masks, this is a reminder to regularly wash your hands as well. Compared to wearing a mask, cleaning your iPhone or wiping down your groceries are just distractors. There's little evidence that fomites or contaminated surfaces are a major source of transmission, whereas there is a lot of evidence of transmission through inhaled droplets. As of now, since we do not have an effective vaccine, it remains imperative to follow set social distancing measures of your area, and wear masks. It is our duty to keep each other healthy. We hope you all stay safe.